Brittany Levy from Stay Current, and this is an article that you should know. This article, titled Massive Transfusion in Pediatric Trauma Does More Blood Predict Mortality, was published in the Journal of Pediatric Surgery in February 2022. So the study posed a question. Does the amount of blood transfusion that you give within the first 24 hours of trauma in kids that are getting massive transfusion protocol predict their mortality? So how did they do it? So they looked at 633 kids. 58 died within the first 24 hours, 78 died after 24 hours, but 575 survived. So here's the big question. Was there a difference? And no, they found no statistically significant difference in blood transfusion requirements in any of those three groups, implying that the amount of blood you need isn't linked to patient outcomes, and there's no amount of blood transfusion that's futile in pediatric trauma. Check back for more articles that you should know.